You may find it interesting, the anatomy behind a brow bone reduction. This skull actually depicts it pretty well. If you can see these little air bubbles in here, they're actually pockets of air sitting within the bone. This is called the frontal bone. So if I'm doing a brow bone reduction, I can't just burr down the bone because you get into this airspace here. This airspace actually connects inside your nose. And so when I am doing a brow bone reduction, I'm actually going from outside in, reshaping the brow ridge here. But then when I get to an area where I'm close to the sinus, that's where I have to actually remove this part of the bone here, set it back, and use some titanium plates and screws. And so what that does is leaves the bone here as a really thick piece of bone, where if you were to get in a car accident or hit your head or anything like that, this bone is nice and thick and strong. And so the chances of you fracturing that bone are a lot less than if you were to burr the bone down to be really thin. So this is the safest way to do it. I use some titanium plates and screws, one here and one right here. And that allows the bone to sit in the right position and heal in just nicely. So this is actually safer, at least in my hands, than even getting your tonsils out, which is kind of crazy to say. It's the most powerful procedure in facial feminization surgery because the upper third of the face plays the biggest role in creating a feminine profile to the facial structure. I hope this really helps, and let us know if you have any questions. Please leave a comment below.